Hello, everybody. I am physician assistant Isabel Valdez, and by day, I am an assistant professor in the Department of Medicine and the School of Health Professions at Baylor College of Medicine in Houston, Texas, where I see patients and I teach physician assistant students. But by night, I am one of the producers for the Curbsiders Internal Medicine podcast. I'm truly honored to have been invited to the GNSA conference this year in Washington, D.C., where I'll be talking about my journey as an advanced practice provider, and also the journey and that has somehow taken me to participate with and become a producer for the Curbsiders Internal Medicine podcast. I am going to be talking pretty frankly about some of the challenges that I face as a woman in medicine, as an APP in medicine, as sometimes being the only, either the only Hispanic in the room, sometimes being the only APP in the room, and some of those little voices that we sometimes hear, like, "Oh, you can't do it," you know that little voice from the imposter phenomenon that you may or may not experience. So I'll be talking about that and talking to you about my journey every day, my day in, day out journey on surpassing and quieting those voices that tell me I can't do it. Just some of the tricks that I've learned along the way, and I hope that you find valuable. And more importantly, I hope to hear from you. What are your tricks on getting you through the day in, day out? How do you quiet that little voice that says, that creates self-doubt sometimes? So I'm really excited to not just talk about my journey, but more importantly, get to connect with you and hear about your journeys and how you make it every day. I'm really looking forward to talking to other grad students. I work with them in the physician assistant program here at Baylor, but I really want to hear about your experience. What drove you into medicine? I want to connect with everyone that way. And there's so many inspiring stories. In fact, every single one of you has an inspiring story on how you got to here, to this conference, to this day. And that's what I really I look forward to. I look forward to connecting with you and hearing your stories on how you got here, what drove you here, and maybe also give me some ideas for the podcast if there's a topic that you want to hear about, because I'm always looking for ideas. So yeah, those are a couple of things I'm looking forward to. Meeting you, learning about your path to medicine and to this profession. And also I need ideas for my show. What advice would I give to anyone who's trying to advance their career, especially in leadership? There's a lot of things I can say, but I'm going to try to do hit 3 points. The first one is be comfortable with the uncomfortable. As achievers, as planners, we always have a plan set. We're like, I know what's going to happen, step 1, step 2, step 3. But every now and then life is going to throw a wrench at it. And that gets very uncomfortable for someone who's such a planner, for someone who's such an achiever. Like, this was not part of the plan. So being comfortable with the uncomfortable is the first thing I would say. In fact, something I tell my students every day. The next thing I would say is to lead with your heart and lead with kindness. There's so many people in the leadership rooms who maybe elbowed their way up there and maybe did it in a way that hurt other people, perhaps, or do things in a way that they advance in themselves as opposed to advance the good of the group, the good of everyone. So when you're in the space of leadership, lead with your heart and that means sometimes backing down and saying, that's not my forte, but this person here is fantastic at that and I'm going to support this person. And sometimes it's leading with our passion, like my passion is doing this and I really would be great at it if I'm given the opportunity. So trying to follow that little mantra, like lead with your heart. And lastly, I think I would also say it's okay to say no. In fact, no is a full sentence, is a full stop, because You always want to do things that are going to advance your passion. So once you know what your passion is, right? What is your North Star? I tell my students, what is your North Star, and what's your guiding light here? And if there's something that comes to you, if there's an opportunity that someone throws at you and says, you should do this, and I need you to do this, always ask yourself, is this going to help me get towards my North Star? And your North Star may be education, your North Star may be clinical work, your North Star may be research. If there's some opportunity that comes to you that doesn't match that North Star, that doesn't get you to that, then it's okay to say no. It's the hardest word in the language sometimes, but all the no's that you're going to say are probably going to prepare you for an amazing yes that you will not regret.